Akathisia is a movement disorder that makes it hard for people to stay still. It's often described as an inner restlessness. People who suffer from it find it difficult to sit still, frequently finding themselves pacing around the room. They experience a feeling of inner pain and severe discomfort. Imagine a feeling of terror so intense that you want to peel away your skin. Picture an inner restlessness that simply won't let you rest. That is what akathisia feels like, a condition often induced by quitting psychiatric drugs abruptly or tapering off too quickly. Now consider this. You wouldn't land a plane by crashing it straight down, would you? In the same sense, when someone's dependent on psychiatric drugs, tapering off should be gradual, like a carefully controlled descent. Unfortunately, our detox and rehab industry often fails to acknowledge the difference between addiction and physical dependence. A sudden halt of drugs leads to severe withdrawal symptoms, including akathisia, which can feel like a never-ending torment. When patients are gaslighted, told their symptoms aren't real, the despair deepens. What these sufferers need is understanding and belief, not dismissal or worse, more drugs. So the question becomes, how do we treat akathisia? For a condition caused by medication, additional drugs usually aren't the best answer. Instead, we need to educate doctors about the condition and encourage families to offer their understanding and support. And there are ways for patients to manage the symptoms themselves, like controlled aggression, long walks, and even spiritual practices. The important thing to remember is, akathisia doesn't last forever. It does get better with time. Let's stop gaslighting people with medication-induced akathisia. Let's stop crashing the plane and start landing it safely. Let's work together to navigate the descent and ensure a safe landing for those afflicted.